Hello, in this video I'm going to talk about knee and ankle muscles. So in the previous video, in the hip muscles video, I already talked about some muscles that also cross the knee, so like gracilis, sartorius, hamstrings. So I'm not going to cover them again here because we already talked about those, but I'm going to cover the additional muscles that also cross the knee and move the ankle. So the quadriceps group, we already talked about rectus femoris in the hip video, but now I'm going to talk about all four as a group. So our quadriceps muscles, we have rectus femoris, vastus intermedius, vastus lateralis, and vastus medialis. Rectus femoris of our four is the only one that crosses the acetabulo-femoral joint. Therefore, it's the only one that can have action at the acetabulo-femoral joint. The other three all originate on the femur, so they do not have action at the hip. Then they all come together and insert together collectively at the tibial tuberosity, so that prominent bump in the anterior superior part of the tibia. Okay, so rectus femoris is the only one that crosses the hip, so it is the only one that flexes the acetabulo-femoral joint. And then all quadriceps, all four together, extend the tibiofemoral joint. Okay, gastrocnemius. This is the main mover, the big strong muscle in the posterior part of your calf. It's the most superficial, so it's the one that is most easy to palpate in the back of your calf. It crosses both the knee and the ankle, so it has actions at both. So it's on the posterior part of the knee, so that means that it's going to flex the tibiofemoral joint. It has two heads that come up to either side of the knee. So it goes from the condyles of the femur, the two heads, and then comes down to form one collective belly and joined together at the calcaneal tendon, also referred to as the Achilles tendon. So then the Achilles tendon or the calcaneal tendon attaches to the calcaneus, the heel. And so when it contracts and the origin and insertion get closer together, that's going to cause a hinging effect at the ankle, which is plantar flexion. Okay, so it's our strongest plantar flexor. Now, importantly, if the knee is flexed, gastrocnemius is not the main mover at the talocrural joint. Okay, so if the knee is flexed, there is slack on the muscle, essentially. So when it shortens, it doesn't shorten enough to transmit force to the calcaneus to cause plantar flexion of the talocrural joint. We call that active insufficiency, and we'll talk about that in a future lecture when we talk about biarticular muscles. Okay, so if we're, like, let's say we're sitting, like I'm sitting on the couch right now. So let's say we're in a seated position and the knee is flexed, and now I plantar flex my ankles. The prime mover will be soleus, which I believe is probably our next muscle here. Yeah, so soleus. On this picture, we're seeing where gastrocnemius is cut away. So we're seeing the heads of gastrocnemius cut and soleus, which is deep to that. So it's a broad, flatter muscle that originates on the tibia and fibula and goes down to join gastrocnemius into the calcaneal tendon. But it does not cross the knee, so it's not affected by whether the knee is flexed or extended. Okay, so soleus, if I'm in a seated position and my knees are flexed and I plantar flex the talocrural joint, soleus is the prime mover in that case. Now, if I stand and my knees are extended and I plantar flex, then gastrocnemius will be the prime mover because it's a bigger, stronger muscle. It's gonna contribute more force to that action than soleus. Soleus is more of a postural muscle. So like if I'm standing or walking or whatever, soleus is more of a postural muscle that's going to be engaged if I'm standing still. It's going to be activated to help me maintain my posture and balance. Gastrocnemius is more of an active mover type of muscle. It's going to be really important in gait, jumping, running, any kind of explosive action. And we'll talk about plyometrics and the stretch shortening cycle and all of that in future lectures when we get there. So those are all topics that are very important in the action and function of gastrocnemius versus soleus. So Soleus and Gastrocnemius plantar flex the talocrural joint, but which one is the prime mover depends on the position of the tibiofemoral joint. Okay, so knee flexed, it'll be Soleus. Knee extended, it will be Gastrocnemius. Okay, and again, we'll get into that in more detail down the line. So gastrocnemius and soleus come together to form the calcaneal tendon, which inserts into calcaneus. So you will sometimes hear the two muscles together referred to as triceps suri. Sural, S-U-R-A-L, is the anatomical region of the calf. Tricep, as in three heads, suri, as in the calf. So gastrocnemius has two heads plus soleus, that's three heads collectively. So triceps suri is the collective term for the two separate muscles. Okay, tibialis posterior is a smaller muscle deep to soleus. So in this picture here, we're seeing gastrocnemius and soleus removed, and what is underneath that there in the center is tibialis posterior. So its actions are to plantar flex the talocrural joint, because it is a posterior muscle that will lift up on the heel, that's plantar flexion, but it also inverts the subtalar joint. So it's because of its insertion, so it's its line of pull, again, the angle of pull of that muscle over that joint. So if we look at this picture, it's a really excellent picture that shows tibialis posterior. So in this picture in the bottom left corner, you can see tibialis posterior going down the posterior part of the calf, but then it doesn't just go straight down to calcaneus, it kind of loops medially around calcaneus. And then if we look on the bottom of the foot, there in that picture next to it, you can see where tibialis posterior has all those tendons that project out and insert into the tarsals and the bases of the metatarsals. Okay, so tibialis posterior is on the posterior part of the calf deep to soleus, but it loops underneath the foot to the medial side of the foot. So when it pulls up, it's going to cause inversion of the subtalar joint in addition to plantar flexion. Okay, Flexor digitorum longus is the next door neighbor to tibialis posterior. So again, this is deep to gastrocnemius and soleus. It's what's highlighted in green in this picture here on the right. So it's, again, it's on the posterior side, but then it's going to loop kind of toward the medial part of the foot, and then the tendons all extend under the plantar surface of the foot. And we can see in that top picture, we have all of those tendons that are going out to the second through fifth phalanges to flex the digits. Okay, so going to the anterior side of the crural region, meaning the leg between the knee and the ankle. So tibialis anterior is our strongest muscle on that side. Its main action is dorsiflexion of the talocrural joint. It is the biggest, strongest muscle on the anterior side that is going to contribute the greatest amount of force to dorsiflexion. But then it also, because it goes to the medial part of the foot, is going to invert the subtalar joint. So it inserts in the medial cuneiform and base of the first metatarsal. So when its insertion gets closer to its origin as the muscle shortens, it's going to lift up on that medial side of the foot, which is inversion. Okay, extensor digitorum longus is lateral to tibialis anterior in terms of its belly. And just like flexor digitorum, it's going to go out to the second through fifth digits, and it's going to extend the digits in addition to also being a dorsiflexor because it's going on the anterior part of the shin down to the foot. Okay, any hallucis muscle is referring to the big toe. So extensor hallucis is the muscle going out to the top of the big toe to extend the big toe, or the first toe or the first digit, however you want to state it. But also because it's on the anterior portion of the ankle, it will lift up into dorsiflexion of the talocrural joint And because it's angled toward the medial side, it will lift up on that big toe, contributing to inversion of the subtalar joint. Okay, and then finally we have Peroneus, Longus, and brevis. These are our muscles in the lateral compartment of the leg. And when I say leg, I'm referring to the segment between the knee and the ankle. Anatomically, that is the leg. Between the knee and the hip is the thigh. The whole limb is the lower limb or the lower extremity, but specifically, the leg is anatomically between the knee and the ankle. Okay, so Peroneus, Longus, and brevis are in that lateral compartment of the leg. Um, they evert the subtalar joint and assist in plantar flexion of the talocrural. So it's more towards the posterior side than the anterior, which we can see in this picture on the left here. You can see there's fibularis, longus, and brevis. That's just another name for the same muscles. It's Peroneus, longus, and brevis, or fibularis, longus, and brevis, same thing. They're really going down the length of the fibula, which is more towards the posterior part rather than the anterior. So because they are somewhat posterior, they're going to assist in plantar flexion. But more than anything, they're lateral. So they're going to lift up on that lateral side of the foot, which would be eversion of the subtalar joint. So longus projects a tendon all the way underneath the foot, all the way to the first metatarsal and medial cuneiform, like we see in that picture there, versus brevis that just goes straight down to the fifth metatarsal and ends there. Okay, so that is all I have for you in this lecture. Thank you for watching, and I will see you for the next one. Bye.